Alright you guys, welcome back to Total Dialysis. This is part 2 of the home dialysis treatment. In this video, we'll be doing the self-cannulation, which means to stick yourself with your own needles, and the process of getting on the machine, also the process of coming off. Alright, so let's dive into this. The first thing you want to do, of course, is put your gloves on. Alright, cleanliness is still next to godliness. And when it comes to your body, you want to protect yourself in all ways, form, and fashion. Okay? This includes putting your mask on because you are going to be dealing with an open skin. Okay? Go ahead and get your Accept wound and skin cleaner that we put inside the gauze there. You're going to clean the fistula. Make sure you wipe it well. After that, you're going to go ahead and get your needle. And you're gonna feel exactly where the fistula is at, all right? You're gonna look for the thrill, which is the vibrating under the skin, and you're gonna feel for where it's strongest, okay? Once you have a pretty good idea of where that is at, you're gonna go ahead and take a shot. Stick the needle inside there and find out if that's it, all right? So make a very educated guess, okay? And sometimes you'll mess up. Like right here, I stuck the needle in, and as you see, I missed. All right, and so I'm gonna try it again. When you pull the needle out, you're not gonna pull it out all the way, just enough to redirection it, okay? Because you don't want the skin to be open. In case you did hit it and you went through it, you don't want all that blood to come out, all right? So here, we finally got it hit, okay? We've got inside the vein, and you carefully push. Now I'll carefully push the needle inside to make sure the needle stays inside the vein, all right? You'll see this, as you see, there's a red pulse of blood coming out, and that blood is pulsing very strongly. And that's a good sign that you're inside the vein. If you hit it and the blood comes out and it stops pulsing, that means that you either went too far, or you infiltrated the vein, or you're pushing up against the wall. It should be a very lively pulse, just like this. So once you figure out that you have it, you're gonna go ahead and open up the cap on the tubing connected to the needle and let the blood run all the way through the top. Because now we have to test it to make sure the pressure inside the vein is good. Otherwise, it will stop your machine, okay? So to do that, we're going to take the top off the tubing. We're going to connect a pre-filled syringe to the dialysis needles tubing, and we're going to, oh look, I forgot to open it. So then we're going to open it, and we're going to pull back and push it in, and pull back and push it in. And if it's giving you resistance, like if it's giving you strong resistance, like I don't like how this feels, right here you could tell, you can see how I'm pulling it and it's the air like that. I don't like how that feels. So I'm going to try to adjust the needle as much as I can. All right, again, do not pull the needle out. Just redirection it carefully so that it is positioned better in the vein, so that there is better blood flow through the dialysis needle. That is very careful. So after I've adjusted it, I'm gonna try it again. Oh, okay, here we go. We're gonna try it. There it is. And I like where it's at, just like that. You see how easy it goes in and out? It goes in and out. Very easy, just like that. All right, so I like that position, and I'm gonna try to tape the needle right there. All right, again, take your time, be patient with yourself. You don't have to get it right the first time. You do have to be patient with yourself though, all right? So go ahead and tape a gauze to a piece of tape and tape it over where the contact point is, very gently. All right, for the second needle, you're gonna fill out the vein again, the fistula again, and once you get a strong thrill, go ahead and make contact at that point. And you see I hit it right here at first try, which I was very proud of myself for. As you notice, you don't have to go too deep. The fistula is typically around the surface of the skin, okay? Which is why they are very delicate, and they tell you to be careful with it. It is very close to the surface of your skin. So after examining that stick, I decided I like it. I like the pulse. Use a very strong pulse. I'm gonna go ahead and tape it securely. And then I'm going to test it. I'm sorry for the blurriness. I was in the moment. I was trying to work with this as best as I could. And now we're going to test it just like I did before. All right, then we close it, get the syringe ready. Make sure that you secure the line. Close the white tabs right there at the line. Now you open it and then you test it, okay? And again, it's about checking the pressures. The pressure seems great, so we're gonna go with it. All right, after we've like that, we're gonna take a piece of gauze. We're gonna secure it to a piece of tape again, and then we're gonna put it over the stick, the contact point, all right? So there you have it. The cannulation went well, and now we're going to add the heparin. And of course, the heparin is there to keep your blood from clotting, all right? And so this is my prescribed dose of heparin that I need to go ahead and put into my blood. So I'll pull it out, and I put it inside the venous, because the venous is going back into your body. So you want the heparin to go into your body, and you want the other line, which is the arterial, that's going to be pulling from your body. And I should have pointed this out. The bottom one, the vein closest going towards your hand, the vein closest close to your hand, the site closest to your hand is your venous. All right, okay, so now we're going to connect the tubes to the dialysis lines. All right, so the red one is the arterial, and the blue one is the venous. And I just connected the venous, which is going to be pushing the blood back into my body, and the arterial, which is the red one, is going to be pulling the blood out of my body into the machine. Okay, and it's important that the venous is connected to the dialysis needle closest to your heart, and the arterial is connected to the dialysis needle furthest from your heart, okay? So after we secure these lines and we've got enough tubing, we're gonna tape it to the arm and secure it to the arm so that if my arm moves, it won't pull, those lines won't pull on those needles, because you do not want any accidents. All right, these are very critical stages when putting yourself on to dialysis, okay? So securely tape those tubes to your arm, then unlock the secure clips. It's gonna be about 4 of them. Unlock all of them to begin your dialysis treatment, all right? So after that, I'm gonna press the green kidney button and the treatment begins. Once you press the green kidney button, the machine begins to pull the blood through the arterial line, takes into the machine, and then it cleans it and returns your blood through the venous line, all right? And once you begin that, my tablet, which is connected to my machine, begins calculating the limits, the pressures in my veins, and then I begin to write down the blood pressure as I go throughout the treatment. You know, I record all this and I get comfortable. And then my treatment time runs for about 3.5 hours, and gives you a lot of time to think about just how we're able to do this crazy thing of staying alive, you know. And while we're grateful, it takes a cost it costs something from your life. You know, with your family, with your time, with your job, your money. You know, you have to give things up to be here. Okay. So now the machine is done. We're going to press the stop button, and I'm gonna take off the syringe connected to the saline bag. I'm gonna securely stop the lines by pressing the clips, and I'm gonna disconnect the arterial tubing and connect it to the saline bag. I'm gonna connect the syringe to the arterial line. I'm gonna release the clips on the saline bag and the arterial line, and then I'm gonna press the add fluid button. And as you see, it begins to run the saline through the line and through the machine to return my blood back to my body. Now here, we're going to go ahead and flush this line out. Be careful of air bubbles. Alright, so after the line is finished, you're going to go ahead and switch and add the other syringe, or put the other syringe to the venous line, and you're going to go ahead and finish flushing that out. You're going to remove the tape while carefully holding your tubing in place as to not yank anything that's not supposed to be yanked. And then you're going to go ahead and prepare the gauze. And then again, carefully remove the tapes around these needles. And you have to be very careful with this because you don't want to accidentally stick the inside of your fistula. You don't want to accidentally pull it out. And you just don't really want any mistakes with this, all right? So since I'm taking this off by myself, I'm gonna grab the syringe. If you can pull the protection cap down, it's best to do so. You're not gonna always be able to do that, as you'll see later in the video. Carefully pull the needle out while covering the wound at the same time, and you're gonna hold the wound for 5 minutes while putting the needle aside, okay? After 5 minutes, it's about done. It's not going to be bleeding, and it shouldn't be bleeding, because if it bleeds, it's going to squirt blood. You'll notice. All right, but once it's done, you're going to take another gauze, you're going to make another ball, and then you're going to tape it up, and you're going to put it over the wound. All right. Now remove the other tapes first, because it would have been a struggle to remove them if I had taped up this site and then began to take the needle from the other site, and I had the tape taped under. All right, it would have been very complicated. So you don't always have to do this. It depends on the positioning of your needles, but the position of mine calls for me to do this. So when you're taking the tapes off, again, I cannot emphasize how careful you need to be. All right, if you don't feel confident to do it, then make sure you do this with a partner around, or start with your care team first, okay? All right, so as you see that now that I have this next needle prepared to come out, I'm gonna go ahead and get my gauze ready. Again, we're gonna fold it, and then we're gonna go ahead and we're going to pull the needle out carefully while holding that in place also. Again, and when you pull these needles out, make sure you're careful around them, because they are still a danger. All right, yes, set it to the side, but be mindful of your arm, be mindful of the needle. It's too easy to stick yourself. All right, once the 5 minutes is up, you're gonna go ahead and tape both of the sites up well so that there is no accidental bleeding. Make sure that they stop bleeding before you tape up, and tape it up to protect them as it heals for the next day. All right. After that, stand up get your blood pressure, record your vitals, record your weight. Go ahead and drain the dialysate and then let it drain. It usually takes about 2 hours if you're paying attention to it, and then it'll beep and let you know it's time to take everything down. That'll be another video. But that was the process of a dialysis treatment. All right, I know it's not ideal, but it's still a way to live, and you still can make that life a good life while on dialysis. Yes, it takes a little effort, but it's worth it. All right. Leaving comments, leaving questions. I am definitely here for you. Any topics that you have that you want me to cover, send that to my email at yourtotaldialysis.com, and I will definitely answer that or make a video on it. All right. Remember, you can still make it a good life. See you later.